This is my student support system. Keep watching, keep learning. Hello students. In today's class, we are going to discuss about role and responsibilities of nursing supervisor. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel My Student Support System. Role and responsibilities of a nursing supervisor. Many times this question arises in examination. Dear students, answer is very simple. Supervisors are the middle level managers, so they have following three types of responsibilities. What are those? These are number one, upward responsibilities. Number two, downwards responsibilities. And number three, responsibilities during supervision. Let us see what are these three responsibilities. First one is upward responsibilities. It means responsibilities towards administrators. Under this, supervisors have responsibility of identifying the activities that authorities need from him, either institutional or in community setting. Supervisor has to make arrangements to carry out these identified activities in best possible way. Supervisor should always keep in touch with the higher authorities about what is being done or what he is doing. He should suggest measures to improve efficacy or efficiency of health personnel or nursing personnel and efficiency of performance. And supervisor also act as a liaison between higher authorities and subordinates, interpreting the requirements of the authorities. Timely refer matters to immediate officers in the hierarchy which are required to draw their attention to deal with, and timely submission of staff evaluation report to the administrators as and when required by them. Now we will discuss about the downward responsibilities. Downward responsibility means towards subordinates. The supervisor assists in selecting, orienting and training of new staff and students. He should teach them to demonstrate concern, decorum, manner, tact and courtesy in their day-to-day dealings. He helps them efficiently, humanly communicate with their clients and all other concerns. He should build good interpersonal relations among the workers. Assign duties and responsibilities to right staff to perform right job at right time. Help subordinate staff to perform their job effectively when needed. Manage for their leave, day offs and rotation plans. Appraise the nurses' performance for guidance and help the nurses to adjust to the situation when needed. He also assists the nurses to take pride in their work, urging them to do their best with dedication, human concern and sense of involvement, and help them to develop a value system that would be beneficial to the clients at all levels. Now we will discuss about the responsibilities during supervision. Supervisor has specific roles and responsibilities during home visits, clinic supervision, or school and other community organizations. First, what are the responsibilities during home visit? During home visit, the supervisor is expected to make specific observation on the approach to the family, how the staff is approaching to the family, the action taken by the worker to meet the need or problems of the family, either standing order is observed adequately or not. the response of health teachings performed previously, the plan made with the family about further course of action, the nursing techniques followed, and whether all aspects of health problems are dealt or not. Now, during clinical supervision, supervisor is expected to visit the clinic where the worker is working and then make observation on physical setup of the clinic, sterilization of equipments, nursing procedures means steps of the nursing procedure being carried out, check clinical record maintained by the staff, health teachings being carried out for the patient and attendance, supply, storage, maintenance of drug and supplies. Now, school or any other community organization. Supervisor is also expected to visit schools and related community organizations, especially health related, with the staff for helping in identifying needs or problems of the school children and community people, assistance in planning the health program for the community, guidance to implement the plan by providing supplies and material, checking the records maintained by them, conducting individual and group conference, and appraising the efficient and effective service rendered duly. Thank you students for watching this video. You can subscribe the channel for latest updates, and for making your notes you can visit mynursingstudents.blogspot.com. Thank you. Have a nice day. My student support system. Keep watching, keep learning.